chromosomal abnormalities, Down syndrome, Turner syndrome, and other common genetic disorders. Chromosomal abnormalities are conditions that arise when there are changes in the structure or number of chromosomes, which are the carriers of genetic information. These abnormalities can occur due to errors during cell division, specifically during meiosis or mitosis. These errors may result in extra chromosomes, missing chromosomes, or structural rearrangements of chromosomes, leading to various genetic disorders and birth defects. Types of chromosomal abnormalities. Numerical abnormalities. Changes in the number of chromosomes. Trisomy. The presence of an extra chromosome. For example, trisomy 21 leads to Down syndrome, where there are 3 copies of chromosome 21. Monosomy. The absence of one chromosome. Monosomy X leads to Turner syndrome, where females have only one X chromosome instead of 2. Structural abnormalities. Structural changes in the chromosomes, such as deletions, a section of the chromosome is missing. Duplications, a section of the chromosome is duplicated. Translocations, a segment of one chromosome is transferred to another chromosome. Inversions, a section of the chromosome is reversed. Common chromosomal abnormalities. 1. Down syndrome, trisomy 21. Cause: Down syndrome is caused by an extra copy of chromosome 21, making a total of 47 chromosomes instead of the usual 46. This is known as trisomy 21. Symptoms: physical features: flattened face, almond-shaped eyes, short neck, and a small mouth. Developmental and cognitive impact: mild to moderate intellectual disability, delayed speech, and motor skills. Health issues: increased risk of heart defects, gastrointestinal issues, thyroid problems, and hearing loss. Incidence: the likelihood of having a child with Down syndrome increases with maternal age, particularly after age 35. Diagnosis: can be diagnosed prenatally through amniocentesis or non-invasive prenatal testing, NIPT. Second Turner syndrome, monosomy X. Cause: Turner syndrome occurs when a female is born with only one X chromosome, 45X0, instead of the usual 2 X chromosomes. Symptoms: physical features: short stature, webbed neck, low hairline, and broad chest with widely spaced nipples. Health issues: ovarian insufficiency, leading to infertility and lack of puberty in many cases, also associated with heart defects, kidney problems, and hearing loss. Cognitive impact: normal intelligence but learning disabilities, particularly in mathematics and spatial reasoning. Incidence: Turner syndrome occurs in about 1 in 2,500 live female births. Diagnosis: can be detected using karyotyping, a test that examines the chromosomes. Third Klinefelter syndrome, 47XXY. Cause: Klinefelter syndrome is a genetic condition in males who have an extra X chromosome, 47XYX. This leads to a total of 47 chromosomes, including 2 X chromosomes and 1 Y chromosome. Symptoms: physical features: taller than average stature, reduced muscle tone, and less facial and body hair. Reproductive health, small testes, which leads to reduced testosterone levels and infertility. Cognitive impact, mild learning difficulties, especially in language and executive function. Diagnosis, typically diagnosed through karyotyping or chromosomal analysis. Incidence, occurs in about 1 in 500 to 1,000 male births. 4. Patau syndrome, trisomy 13. Cause, Patau syndrome is caused by an extra copy of chromosome 13, trisomy 13. Symptoms, physical features, severe intellectual disability, heart defects, cleft lip palate, polydactyly, extra fingers or toes, and structural brain abnormalities. Health issues, organ abnormalities, particularly in the heart and brain. Incidence, occurs in about 1 in 10,000 live births, but many affected infants do not survive beyond the first year. Diagnosis, can be diagnosed prenatally with amniocentesis or chorionic villus. Sampling, CVS, Femte-Edwards syndrome, trisomy 18. Cause, Edwards syndrome is caused by an extra copy of chromosome 18, trisomy 18. Symptoms, physical features, low birth weight, clenched hands with overlapping fingers, rocker bottom feet, and heart defects. Developmental impact, severe developmental and intellectual disability, health issues, life-threatening complications, including heart defects, gastrointestinal abnormalities, and kidney problems. Incidence, occurs in about 1 in 5,000 live births. Many affected infants do not survive beyond the first year. Diagnosis, prenatal testing through amniocentesis or NIPT can detect trisomy 18. 6. Triple X syndrome 47 triple X. Cause, triple X syndrome occurs when females have 3 X chromosomes instead of the usual 2 47 triple X. Symptoms, physical features, typically no major physical abnormalities. Some may have slightly reduced height. Cognitive impact, mild developmental delay or learning disabilities. Reproductive health, usually normal fertility. Incidence, occurs in about 1 in 1,000 female births. Diagnosis, can be detected through karyotyping or genetic testing. 7. XYY syndrome 47 XYY. Cause, XYY syndrome occurs in males who have an extra Y chromosome 47 XYY. Symptoms, physical features, taller than average stature but otherwise normal appearance. Cognitive impact, mild learning difficulties and slightly delayed speech and motor development. Behavioral issues, some individuals may have a higher risk of learning disabilities, attention problems, and behavioral disorders. Incidence, occurs in about 1 in 1,000 male births. Diagnosis, can be diagnosed through chromosomal analysis. Diagnosis and genetic testing. Karyotyping, a laboratory test used to examine the number and structure of chromosomes to detect numerical and structural chromosomal abnormalities. Non-invasive prenatal testing, NIPT, a blood test that analyzes fetal DNA fragments in the mother's blood to detect conditions like Down syndrome, trisomy 18, and trisomy 13. Amniocentesis and chorionic villus. Sampling, CVS. These tests involve taking a sample of amniotic fluid or placenta tissue to analyze fetal chromosomes for abnormalities. Genetic counseling. Couples with a family history of chromosomal disorders can undergo genetic counseling to understand their risks and make informed decisions about pregnancy. Conclusion. Chromosomal abnormalities can have significant impacts on a child's development and health. Disorders like Down syndrome, Turner syndrome, and Klinefelter syndrome highlight how deviations in chromosome number or structure can lead to various physical, cognitive, and health-related challenges. Advances in prenatal testing have made it easier to detect these conditions early, allowing for better preparation and care for affected individuals. Understanding these genetic disorders also opens the door to better diagnostic tools, treatment options, and potentially even gene therapies in the future